with Missy M. Ready? Hey everybody, it's Dr. Pink from Diamond Creek Farm. Welcome back to our farm, and we're going to do another chat today. Today we're going to talk a little bit about normal and normal things for horses. And when I was an intern right out of veterinary school, I had a clinician who mentored me, and he was really a great person, great veterinarian. And he would always tell me, you can't know abnormal till you know normal. So we focus a lot on normal here, and everybody always thinks, oh, I should know all the weird and crazy stuff. And that's actually not right. You want to know that your horse is normal and what is normal for your horse. Because once you know that, and you know that really well, then you can look at things that are slightly abnormal, and then you might think, oh, this is not right for this horse, and I now have to call my veterinarian and discuss some different things that might be abnormal. So I'm going to introduce you to Missy M from the HHYF. She's going to be my partner in crime today as we go over some things. Fun fact about her, she gets to now spend her summer with us, although she'd much rather be out at the camps with the campers and on the track teaching young kids how to drive and such. But in the state of the world, obviously she's got to stay back with us, so she gets a little extra off season, or an off year, I guess. But she won the Hambletonian last year for the HHYF drive with the kids. So she may be a little bit small and stuff, but she is fast and definitely mighty here. So she's going to be our spokesperson for the day. I think she's sort of excited about it. What do you think? Maybe? Maybe not. So one of the important things to know about horses is what we refer to as their TPR, so their temperature, their pulse, and their respiration. And those are things that people should know right off the bat. And there are, depending on which resources you look at, different variations of what those numbers should be. But a real easy tool to remember is the 10, 20, 30, 40 rule. So for the respirations, 10 to 20 breaths per minute. The pulse, or the heartbeat, 30 to 40 beats per minute. So as long as you're in the 10, 20, 30, 40 range, that is a really good tool to remember. Their temperature should be somewhere between 99 and 101.5 degrees. Anything outside of that range is considered to be abnormal. If it's a really cold morning in January and the horse is acting totally normal and the temperature is 97 degrees, I don't really worry about it too much because it's really cold. In the summer, yes, they can overheat some, but I still don't want to see them. She doesn't want to see them above 101.5. So, right? That's right. So we're good there. So some of the things that I think people should have in their regular barns so that you can know some of these vital signs is a stethoscope. We'll get to this whole cart a little later. And a thermometer, and then a pen light or a flashlight. So stethoscopes, yes, I have a fancy large animal equine stethoscope that's expensive from Littman. It's a veterinarian brand, but you can go to your local CVS, Walgreens, Walmart, what have you, and you can buy an El Cheapo that will do just fine for you. You don't have to spend a lot of money on it. So in order to listen to the heartbeat so you can get a heart rate, where you want to listen is on the left side of their chest, right underneath their elbow. And sometimes you really have to shove the bell of the stethoscope up and in underneath that shoulder muscle so that you can actually hear the heart rate and hear the heartbeat. One of the other things about wearing a stethoscope is you can see how the earpieces go inwards. So you want to make sure that when you are putting your stethoscope in your ears that they're pointing forward. So this would be the correct way to put it on, like this. And that way it can get down into your ear canals and you can hear better. So I'm just going to put it in my ears. Hi, Missy. And then I'm going to listen for her heart rate. And you can see how far up I am underneath her elbow. and she has a normal heart rate for her. Now, if you're having trouble getting the heart rate from here, another spot you can do is right underneath their cheekbone, which is what we call the mandible. There's a submandibular vein right here. And this is more of a feel type of thing. And you can feel it pulsing back against your fingers. And this one's a little bit harder to find. It takes a little bit more finesse because if you press too hard, you'll occlude or block off the vein and won't be able to get a heart rate. But that's also one to get right there. Now, their respiratory rate, when they're at rest, like Bissy is on her extended vacation here, there are two different ways you can try to take their respiratory rate or their breathing rate. You can look at their nostrils and watch for their nostrils to flare out and in just a little bit, which sometimes is hard to do when we're chewing and chomping our lips. She's a great participant here. It's just fantastic. You're doing a good job, girl. The other thing, too, is you can look back here at their flank, and you can watch it move in and out as she's breathing. It's coming out, going back in. Out, in. Out, in. Out, in. So that's another way you can do that. And heart rates are really important when you're concerned with horses colicking, because their heart rate will go up in the presence of pain. And obviously colic refers to abdominal pain. It's just a generic term for abdominal pain. So their heart rate will go up. So if your horse is acting a bit colicky and such, you can call your veterinarian and you can say, hey, I think my horse is colicking. I took her heart rate and it's high, it's 56 or it's 60 beats per minute and stuff. And then, you can get advice at that point as to what to do next. Most likely your veterinarian will want to come out and take it. Now, the next part of your TPR is thermometer. So I highly recommend getting these easy digital 10-second thermometers. Again, you can find them at Walmart or Walgreens, CVS, what have you. Amazon probably even has them. The 10-second ones that are quick, they're very accurate, and for horses that don't particularly like getting their temperature taken, it's very easy to do. So we'll see if Missy likes this. Yeah, she already doesn't like it. So I always just spit on the end of the thermometer just a little bit. You lift their tail up. They got all this hair. Over to the side a little bit, and you just put it in their anus. And then immediately you'll start to see the readout of what the temperature is. And so she's 99.3, so she is A-okay in terms of temperature. When temperatures go up, we're worried about things like infection or viral or like a tick-borne disease type of thing. So knowing that normal range of temperature, the 99 to 101.5 is really good. So that, again, if your horse maybe is not eating their breakfast, you can do some of these things to help your veterinarian out by saying, hey, I've done the heart rate, I've done the respiratory rate, I've done the temperature, and gosh, my mare has 104 fever, and that's not normal. So now we've got to look into other aspects of things to do. So just kind of overall looking at your horse. One of the other things, especially now that we're, twisting, we're getting into fly season. So conjunctivitis is going to start being prevalent, and then with conjunctivitis, the horses start scratching their heads and eyes and stuff, and you end up with corneal ulcers, and their eyes get squinty and stuff. No, not you. No fly mask for you. I know. So with this pen light I have, or a flashlight, the light on the back of your phone works just as well too. You want to make sure that their eyes are nice and wide open, like her. And one of the really good tricks to know if an eye is painful before it gets super squinty and stuff is if their top eyelashes are pointing downward instead of straight out or upward. So you want to make sure that the eyes overall look clear. Both sides, they're symmetric. One's not squinty or anything. You can shine a light into their eye, make sure that their pupil constricts a little bit, which hers does. Just overall clear, shiny, cornea and stuff. Now, with the conjunctivitis I mentioned a second ago, that's usually caused by fly irritation, and so their eyelids on the bottom and the top, you can see right here, were real nice light pink. Up there a little bit darker pink, but that's fine. If they get a conjunctivitis, all of this pink tissue here gets really inflamed, really swollen. They'll start getting some mucus accumulation in the corners of their eyes and stuff, and that's usually caused just by fly irritation. We see that. We have a number of mares here who do that. We just put a fly mask on them, treat them for a few days for the conjunctivitis, and off they go. But with the conjunctivitis, corneal ulcers are on the horizon as well. They can get a corneal ulcer by scratching their head on anything and any time of the year. It's not just a spring, summer thing, but we are on the lookout for flies this time of year. So that's overall, the horse, and, obviously you want to take a look at the poop. Missy just helped us out greatly. You can tell a lot by a horse's manure, and your vet might ask you about the horse's manure. Has the production increased? Is it more fluidy? Is it drier? Has the production decreased? Normal horse is going to have probably 6 to 8, 9 piles of normally formed manure balls like that throughout a 24-hour period. Now, in the springtime, when the fresh grass comes up, the fecal balls tend to be a little bit more cow pie-like, because the grass is lush, it's got a lot of water in there for them, and it's not quite as formed as that. And that's normal for... I know, it's normal. It's normal for springtime to do that. You worry about in the winter when it gets cold and the water consumption goes down, because the horses are cold. They don't want to drink as much water. They can get an impaction, which is basically constipation. And that's when you'll notice they're not pooping as much. Maybe if they're pooping, they've got some mucus on top of their fecal balls and stuff, and that's not normal. So you definitely want to pay attention to their manure output. You want to pay attention to their water output. If they're in the barn, how many buckets are they going through a day? Outside, we have automatic waters. It's hard for us to assess that. Are we boring you already? So tired. And then you just want to make sure that they always have access to clean, fresh water as well. So that's just sort of general overview of the horse. And now we can kind of segue a little bit into some basic first aid and things, and we can talk about a first aid kit and what you would want to have and not have. A lot of things, I have basically disassembled our first aid kit that we have here at the farm. So I use just a regular grooming kit, any kind of kit, box, what have you, Tupperware container, you could totally use however it works out for you. And then I normally have all of this stuff packed nice and neatly into the kit here, but I brought it out so we could talk about some of the things that you may or may not want to use. So if a horse gets a wound, you're obviously going to want to clean up the wound. Now, if a horse impales himself on a tree branch, a metal pipe, a nail in the foot, you don't ever want to remove those things until the veterinarian gets there, because if you remove something, it might be up against a vital vein or artery, and by you removing that, now they're going to start gushing blood and bleeding out and stuff like that. So you want to make sure that you Did you want to be more in the production here? We can move over here. She wants to help. So make sure you don't remove those impending objects. And one of the things that people don't forget or don't think about is that when a horse steps on a nail, and it happens to all of us, and you know, it's tough and your first instinct is to pull the nail out. I would strongly caution you to not pull the nail out, because there are a lot of really important structures in the foot, in the pastern as well. And you want to make sure that that nail hasn't gotten into one of those vital structures and make it more difficult. And you can tell that by a radiograph, an x-ray. So you can tell that, yes, the nail got into the navicular bursa, or got into the coffin joint, and stuff like that. If you pull the nail out, you don't necessarily know, and that will help guide treatment. So basic wounds and stuff that most people can treat on the farm by themselves. They don't need a veterinarian at all. Simple cuts, little lacerations, you know, things that are just basically skin deep. So things that you'd like to think about having here, you just have some betadine scrub, or some Novosan scrub, chlorhexidine. If you've got that, that's a blue color. That's fine. Ivory soap works well too, if you don't have these things. So you want to clean them up real well with some soap. Make sure you get all the dirt and debris off. I have just a sterile water bottle that I'll use to rinse off that the scrub spot, to get all the soap and stuff off. I've got a syringe in case they've got like a little pocket or something. I might flush it out. Again, you can get this at Walmart. You know, I think they have, it's called wound wash. It's like an aerosolized can that's actually really great, because if you're not in a place where you have a hose, it becomes difficult to actually clean the wounds and rinse them off. So you can use sterile water, you can use the wound wash. That works out really well as well. Some sort of triple antibiotic ointment. I've got just a generic triple antibiotic ointment that I get from none other than the Dollar General. And all this is Neosporin without the Neosporin cost on it. So we go to the Dollar General just down here in Wellsville, and we get a triple antibiotic ointment for it. I have what we call SSD, or silver sulfadiazine. It's an antibacterial, antifungal cream. It's really thick. It's white on the inside. It's really good. I call this like my beginner wound treatment. So like I have a beginner and a finisher. A finisher wound treatment would be like a Dermavet, Panalog. This has a little steroid involved in it, which helps keep down some of the proud flesh that horses might get as the wound is healing and contracting. All proud flesh isn't, we've all been exposed to it. It's just exuberant granulation tissue. The granulation tissue, the scar tissue, has decided just to grow and grow and grow, and this will quiet it down, because it's not good to have that on there. Other things you like to have, these are Telfas. You know, we've got two different sizes here, a long one and a small one. This is just a non-stick adherent dressing, so that when you go to, I'll open one up. So when you go to put this on your wound, when you go to change the bandage, like it doesn't stick and tear off the scab or some of the hairs and stuff, and the horses appreciate that as a lot. So, I mean, two different types of sizes. If you only have one size, you can cut it down, or you can take two and stack together to make a longer one. I've done both, so no issues there. I just have some 4x4 gauze to help dry things out. Although the Telfas are really good for non-sticking, they do absorb some stuff, but they don't absorb a lot. So usually I put a little bit of gauze behind the non-stick dressing. So basically it would look something like this. We'll use Missy as an example. So if I were to put this on her leg, I would put this on her leg, and I'd put some of these 4x4s gauze underneath, because these absorb a lot. So for instance, like say she had a wound right here, I'd stick this on here like this, you know, non-stick side here, the gauze on the outside, and then I would wrap it back up that way. Thanks, girl. Other things, when you've got wounds, you've got to think about bandaging. So I have a couple of different bandage materials. I have just a cast padding. You can always use like a cling gauze or something like that, because again, if you're putting this on the wound, you have to actually get the bandage to stay. So I have some cast padding, some vet wrap, and elasticon. If you like brown gauze, you can use brown gauze as well. It's always part of the thing. And then I always nearby have a leg cotton. So this is just an individual leg cotton. If you don't have one of these ones are disposable. If you don't have something like this, you can always use a quilt that you would normally use to wrap the legs for like a shipping bandage or something like that. If you don't have a vet wrap and all you have is a polo wrap, that would work fine too, and you can always wash those as well. Getting, I guess, a little bit more into feet, then we have an animal index pad, which is good for hoof poultice or a foot bandage. If you've got an abscess, you can use this. Another trick you can use is if you've got little kids, babies around, a baby diaper actually works because it fits to the actual size of the foot. So you can use that. Duct tape's always good because it fixes just about everything and anything. And then I go with a hoof pick and some bandage scissors. And so that kind of concludes most of my first aid kit. And then bute. If you don't have bute and you've got Banamine, that's fine. Banamine is also injectable, so most barns will have Banamine. And most barns will have bute. Bute comes in an injectable form, a tablet form, and a paste form. The injectable form can go in the vein. Paste and tablets obviously go in the mouth. Banamine comes in an injectable form and a paste form. To my knowledge, I've never seen Banamine tablets or anything. But Banamine, you want to be careful if you are doing the injections. This is a big thing. Never, ever, ever, ever put Banamine in the muscle, ever. You will set yourself up for a huge disaster, a clostridial myositis, basically a huge abscess on the side of the neck with a bunch of tissue necrosis and sloughing and everything. So if you've got a horse that's really colicking and you want to give it some Banamine and you just can't hit the vein, you can put it in the mouth. So that's your Banamine trick there. So you want to make sure you're in the vein or in the mouth for Banamine as well. Never put Banamine in the muscle. So if you learn nothing else, don't put Banamine in the muscle. And so that's my segue for Banamine. So we got any questions come through or?
Oh, it's a lot of great info.
Okay, good, great.
Anything else to add?
No, I think that about sums up our normal horse and first aid kit. So.
Say bye, Missy.
Say bye, Missy. Thanks, everybody.